Welcome to ABP Desam Health Conclave 2025.
Let's put our hands together and invite the moderator, Diksha Navani. Very warm welcome to you, Diksha. And now let's put our hands together for the speaker, Dr. Preeti Reddy, Vice Chairman, Malla Reddy Vishwavidyapeeth, ABP MD. I know I'm going to get a louder cheers here. Thank you once again. Requesting you to kindly be seated and let's start off with the session.
So a very good morning, everyone. It's a privilege to be here. A very warm welcome to ABP Desam Health Conclave for a session that couldn't be more relevant today. As the world around us shifts from global pandemics to AI breakthroughs, from climate change to risking mental health concerns, one thing becomes very clear: the way we train our doctors, that no longer can remain the same. Dr. Preeti, as someone shaping the next generation of doctors, let me begin by asking you, when we talk about redesigning medical education for a changing world, what do you think is the most urgent shift that we need to make, maybe starting from today?
Well, before we begin, I would like to say thank you. And it's a privilege to be a part of this high-dose, high-impact health enclave. And thank you to the ABP team that they have invited me. And of course, I would like to congratulate and thank everyone to be a part of this enclave, the doctors, the dignitaries, of course, the very dynamic Director of Medical Education who spoke amazingly. Sir, I'm a fan of yours after when I hear you. I myself learned a lot today when I heard you. And of course, all the dreamers in the room, all the medical students, dental students, each one of you from Allied and the organizers. Well, coming to your question, redesigning medical education is actually the need of the hour, and I feel competence-based learning, faculty development, and basically integration of the technology in education. So not only just medical, dental, all kind of health education is absolutely important because that's the need of the hour. So our students should be not just job ready, but future ready. So that's the plan.
Right, absolutely. And next, I'd like to ask, with rapid advancement, we are now in a world where we are moving alongside AI. We have AI diagnostics, we have robotic surgery, and VR-based learning. How should curriculum designers adapt to this AI technology?
Well, if you see the existing conventional methodology of teaching is quite old, and I feel like, introducing all these words like, artificial intelligence, AR, VR into our routine medical education. So basically you need to have this flexible module of education which is more like, technologically integrated. So if you have the curriculum which is more technologically integrated, so that would make our doctors ready, like, the moment they are out of the MBBS, they know how to use these technologies. So that's a plan.
Right. Private institutions now handle a large share of India's medical education. What role can they play in balancing affordability, quality, and also access, especially for rural students?
Well, I would say, again, the use of artificial intelligence should be implemented using the digital forums, the platforms to educate like the students from the rural background. And of course, as Sir said, that, creating more medical education systems in rural areas where we can get the education system right, which is next door. And of course, the hospitals which are going to come will add on more doctors to the rural areas. So I think this would be a nice way to improve the rural areas, improving their medical education as well as health facilities.
Right. So, Dr. Reddy, we also know that the healthcare sector is not clinical anymore. It has also become entrepreneurial. So how can medical students be empowered to become innovators, researchers, and health tech founders?
Yes, it all depends upon the management of the medical education system, and they need to equally give importance to not just academics, but also to the research, like, creating incubators and, innovation centers. So I feel a medical education should not just be an educational hub, like not only just concentrating on academics, but also research and innovation equally, 50-50%. So that would make their, future better for research and innovation.
Right. So, Dr. Preeti, my next question is actually very important. We have seen a rapid increase in mental health issues. There is stress, there is burnout, there is depression. How do you think medical institutions can actually work on this?
First of all, I would like to say all my students out here, relax. You're not in a war. So you're just enjoying. So you opted to be a dentist or a medical student or whatever stream you choose. It should be out of interest. It's not about forcing you to do that. So please first, before you choose your stream, see to it that you're interested. Number two, you're not in a competition. It's a learning, it's a knowledge which you're acquiring. So at the end of the day, you need to understand, okay, fine, I know the subject, I can use it for my future and for my job and whatever. And of course, it's a learning process, so do not take much stress. And especially for a medical education, for the management, I think they should be supportive. Do not make it a terror area where, the students are entered. And of course, there should be discipline. Discipline is different, terror is different. So discipline with relaxed education, and we have the peer counseling, so that's important.
Correct. So as per your experience, what is the biggest gap between medical learning, between what they are learning in the institutions and the actual hospital reality?
Okay, well, again, most of the doctors, I have always seen, they are more into theoretical system. They are all just studying, they're studying, but they don't know. So, for example, if we start exposing our students from the first semester or the second semester itself, from the first year itself, so they know they will have more proximity towards the patient, and they will be studying that aspect itself. Basically, I feel that communication is the most important skill of what a doctor should need, and practical exposure. And most importantly, I think when it comes to nowadays, there are a lot of simulation labs also which have been built up in the medical education. So practicing the way to treat a patient on the simulation from the first year and then exposing them to the patients is also a good idea. So that would be they are more well trained to expose to the patients. Yes.
So as per you think the current education system is still not updated with the real life scenario in the hospitals?
Of course, yes, because the hospital is demanding something else, to be very frank, and our doctors are actually going in some other direction. But then if you try to inculcate both, if you try to get hospital from the first year of the education, that would be comfortable. I think that would be more I think as Sir said, that 80% of a medical education is practical exposure. Absolutely. And theoretical should go hand in hand. So I think even if you see, even in the technological sector, I have seen in abroad, instead of these typical classrooms, they have these small learning areas right next to their incubators. So where they are also understanding, they are industry oriented as well as they are getting educated through classrooms.
So they also get a hand-on experience,
yes,
and they are also learning
experiential learning is the need of the hour. Yes.
Absolutely. With the introduction of the national exit test, how do you see the balance shifting between rote knowledge and clinical competence? Will it raise the quality bar?
Yes, of course, because the shift is required, and focusing more on competence-based learning is the need of the hour. So with the comments of next, I think they will be not, the rote thing will be kept aside, and they will be more understanding. Critical thinking will be adding to your thought process. So there will be, the way of education system will change. Rather than rote, it would be more of critical thinking, I would say.
And that will also increase the quality.
Yes, of course, because you are exposed to the real life challenges, and that will lead to be a better person.
What is your opinion on making internship rotations more focused on preventive and public health exposure rather than just specialty departments?
Of course, very much important because we all finally, after doing the MBBS, most of them opt to do PGs in clinical departments. Agreed. But what is going on, around you in public health? Because finally you are going to treat the patients. If you go to the public area and try to prevent the diseases, means you understand the pulse of what is around you, the public. And then you can be a better doctor. So I think even in any medical education system, like any medical college, should give equal importance for public area interns. Like the interns should be posted and there should be a mandatory posting and training in the public area, like, PHCs. So that's important, and RHTCs. So this is the basic need. And I think the students should also take it very sportively. Believe me, when you are in the urban center, like especially for this MBBS and BDS, that's my experience I would like to add on this. When I completed my MBBS, and then we were like, oh yes, we completed MBBS, and I was feeling like a doctor, but still my surroundings were not making me feel like a doctor. So then when I went to PHC to do my internship for last 2 months, what a respect which I achieved over there. They were treating me like a super specialist because for them, looking at an MBBS doctor itself is a boon. It's a boon for them. So the moment I entered into the PHCs, the actual feel of a doctor comes you from there. The respect and the honor which they give you, even to the post-MBBS doctors, is better felt in rural than urban. Post-MBBS.
Right. Thank you for sharing that. So Dr. Preeti, there is a coming debate over commercialization of medical education. So how do you think India can strike a balance between innovation and also, meeting the goals there?
It all depends upon the regulatory bodies, I feel. The regulation system, they need to create transparency. And it's very important because, finally, even medical education needs a lot of financial support to run it.
Correct, but you do agree that it is overpriced sometimes?
I won't say it's overpriced, but yes, it should be comfortable.
Right.
Because, even today, if you compare to any other business, people are ready to buy lands, they are ready to buy jewelry. Why not education? Sorry, but that's a fact. The reason is, education is okay, a government sector can provide free, but coming to a private sector, it is important because maintaining the infrastructure, if you compare the government infrastructure and the private infrastructure, sorry to say, sir, there is a difference. But then coming to private infrastructure, to maintain the beauty, if you come to our campus, you will surely get mesmerized by the campus, and to maintain the faculty is equally important, to buy all the equipments, and that too now when I'm telling that we need to improve our digital infrastructure, so buying all the servers, the database and everything, it of course, it's a Herculean task and it needs a lot of financial support. And yes, of course, we need to give scholarships too. The people who are, the students who come from a poor family, unable to study, and along with earning money, we need to also support them by giving a lot of scholarships. So,
well, I think, yes, that is
it's a win-win situation for education
that's a valid point
yes.
When you say it's not just about commercialization, but you also need the kind of funds to provide the industry-ready facilities to develop the infrastructure.
Yes, and now sir was also talking about adding artificial intelligence and digital health. That itself, getting those digital dissection tables.
Correct.
Nowadays, cadavers are not available in private medical colleges, so we need to buy the digital dissection tables very soon for them to make them understand. So everything needs funds.
True. Absolutely. Well, do you believe private institutions should be mandated to contribute a portion of services like student-run rural health camps or subsidized care to meet national health goals?
As I said already, it's important for every student to look in what is happening in the public sector, because finally they are going to serve the public sector again. So it's important for them during their curriculum to visit the PHCs, to visit the public area, to concentrate on the preventive care, and so that they become better doctors. Like, because we all as doctors, we just don't treat the patients, but we also guide them that this is not to be done. And finally, the data which we receive from the public sector reminds us that in which direction our country is going. Like recently we had COVID, nobody thought. And then later on we understand which sector, which age, like there are different diseases, communicable or non-communicable diseases, which are common in particular gender, in particular age group. This has to be understood at the end of the day, so that they become better doctors. So,
post-COVID, we also saw a lot of MBBS students choosing the international pathways. So how do you think India can reverse that trend?
I would just say all the students, please come back. Because India, let me tell you, the way education system is growing in India, no other country is doing that. Believe me. And as Sir was telling about Ayushman digital machine, the ABDM,
right.
And there are so many advancements, the NEP 2020, like, integrating the interdisciplinary learning, which is the need of the hour. Like, why does the doctors or the medicos has to know medicine? Why can't they know AI? Why can't they know the ethics, the law? Everything is getting integrated. So I think interdisciplinary is what they are thinking. Second thing is inclusivity and equity is also like, one of the points in NEP 2020, and flexible learning, multiple exit, multiple entry system. I think these all things, like the moment each and every institute start following these things, it would be very easy for a student to do their MBBS or any education in our country rather than anywhere else. And yes, of course, like, embracing the advanced technology in each and every medical education is equally important, because, and also make the global education available in your doorstep, to your doorstep, so that the students, they don't want to look outside. They will rather believe in our education system than somewhere else.
Right. Okay, so before I ask my next question, I actually have a question for our audience, for all the students here. How many of you think you have all the soft skills needed? Do you think medical knowledge, education is enough, or do you think you also need soft skills? How many of you think you have soft skills? I need to see some hands up, empathy,
come on, students, you need to be confident to say yes or no.
Yes, please be confident. I see 3 hands, 4. Okay, so talking about soft skills, Dr. Preeti, we are in this changing era where these things are also of equal importance. Skills like empathy, communication, ethics. And, we feel that especially in medical education, it is often overlooked. So do you think it should also have its own place in the formal education system?
Of course, yes, because doctors doctors should have the most empathy than any other, professional, is because we are more concerned towards care of a patient, and that can come only with empathy. Empathy, being compassionate, being ethical towards what you're doing. Because we are dealing with lives, not with machines.
True.
And lives we all have a heart. So we need to also consider that, the feelings of the patient right in front of you, who is is already suffering he's in a pain. And then we need to be, agar hum log compassionate nahi honge, to aur kaun hoga? So doctors need to be the most compassionate people on the earth, I would say. And most importantly is you need to, I feel like a doctor should be with skills, but with soul.
Correct.
So that's important. So do not leave your ethical aspects, do not leave your empathy just to run I want to be the best doctor, but you can't be best without having empathy.
Adding to empathy and ethics, do you also think communication is also very important? Because you might be very good in what you do, you might be very good in your practice, but if you lack communication skills, you also somewhere are behind in this changing era.
Yes, of course. That's what I told in the beginning, that communication is highly important. Basically,
Right.
I have seen nowadays everyone, the theoretical knowledge is bharpoor hai unko. Like they have the entire theoretical knowledge feeded in their mind, like maybe because of rote or whatever it is. But finally, when you ask them the questions, even during Viva, they are stuck. They're stuck. I don't know why. It's because lack of exposure to practical knowledge or hands-on training. Finally, we are going to deal not with machines, we are going to deal with human beings. So communication is the most important thing. Talking to your patients, most importantly, getting the history. like history, taking the history from the patients is equally important. We all have been now dependent, like, we are dependent on all the investigations rather than having a word or a dialogue with the patients. Nowadays, I see most of the doctors, they just, whenever they are in the rounds, they hardly talk. They will ask for certain investigations. Examination, even per se, like if you say 10 years back when we were studying, we used to take a proper detailed history. The present symptoms, then the present illness, then the past history, the family history, everything used to be included. So history taking is very important. That will come to, some sort of differential diagnosis. Examination, please touch your patient. Please, try to see their pulse, the BP, your own self, because that is also a part of skill, hands-on training. And then you depend on the equipments to finally come to a diagnosis. So communication and one-to-one dialogue is important.
Yes. How do you personally define a future-ready and industry-ready MBBS graduate? What values should they have?
Well, I think they should be technologically literate, and they should be ethically grounded, and most importantly, compassionate. And they should be community concerned. So these are the characters I would expect a doctor to be.
Right. Lastly, you come from a legacy of leadership and public service. Your father-in-law, Shri Malla Reddy Garu, often inspires students by saying, "Palu Ammina, Polu Ammina," highlighting struggle and value. How do you see such real-world philosophies shape the mindset of future doctors?
Well, of course, thank you for taking his name. I always look at him as a visionary. He's been an inspiration to each one of us, especially in education industry. And yes, Palammina, Pulammina is his dialogue, but I think that was then. Now, I don't think so anyone who will just say Palammina and Pulammina will achieve the success what he has achieved, unless you use AI in Palammina and Pulammina. So use your technology even in those areas so that you achieve what it is now. And I think it's easier to be what he is today in this generation. Of course, it's nothing to compare him, but still, I think education is available everywhere. Because of this, utilizing the digital platforms, the AI modules, the AI tools, it's easier to, acquire knowledge wherever you are. So education has become easy. And at the same time, what you need is consistency. The hard work, and everyone talks about we need to work hard, but work hard with a proper disciplined manner. Secondly, work hard in a right direction. Just don't work hard wherever you, in a wrong way. And most importantly is consistency. If you are consistent, I think you can achieve whatever possible.
Absolutely. Well, thank you so much, Dr. Preeti. It was truly an honor to have you here with us at the ABP Desam Health Conclave. A round of applause for Dr. Preeti, everybody. Over to the MC.
Thank you so much, Diksha. And I again thank ABP for inviting me. And thank you to the entire team. I think it's a huge success. Thank you.
Thank you.
We thank the moderator for such a wonderful session, and thank you, Dr. Preeti, for keeping it so impactful. I'm sure the students here are going to take away a lot. Thank you once again, and I would now invite Mr. Sunil Goswami, Editor, Digital Videos, ABP Network, to kindly join us on the stage, and let's honor Dr. Preeti for being here today.